Hello everybody, this is Dr. Ben with Align the Spine Chiropractic. Dr. Andrews behind the camera right now. This is Angie. She has been a patient with us for a couple months now. She came in with left hip and left shoulder pain. The left hip was more of an issue for her, and what we did is we ran her through an ARP neuro treatment on our RX100 unit here, and she got really good results. So we've been treating her hip with that along with adjustments, because we're chiropractors, that's what we do. And she was sold on it right away, and she ended up purchasing a PRS unit, and she's been using it on her hip at home. And Angie, could you go through that process with how you've been treating it at home?
Sure. I have been using this both with a pulsation that you can actually feel the muscle stimulation, and then also with it on a non-continuous mode where it is basically at the tolerance with the electrical current moving actively, and then you put the non-continuous mode on, which then kind of silences the electrical activity, but it's still moving a current through for a healing. So I've been doing that at night, and I have found that by putting it on my piriformis muscle and then on my lower back and keeping it on this non-pulse mode and sleeping a good 7-8 hours with it on, I've been waking up pretty much pain-free. The pain that I was getting was either right into the piriformis, and then sometimes it would come into the hip flexor. And I've tried not sleeping with the unit on, and then I've had to take extra pain medication and salve to try to get rid of some of that hip discomfort. So this week so far I've used it 3 nights, and I have still been pain-free. So this has been a godsend for both using it for active current pulsation and then the TENS unit kind of feel. So this particular unit is probably a little bit more powerful than a TENS unit, so it was well worth the investment. I feel like this is going to be something that's going to save me in multiple areas. So coming here and gathering the skills to be able to use this unit a little bit more effectively at home is going to help me to be able to do more of my own self-treatment. Right. So it's great tool to use, a wonderful investment.
Awesome. Yeah, and that's what's cool about like a PRS is that patients, especially if they take the time to learn it and then use it on themselves with some of our instruction, they can do the treatment and the rehabilitation at home, and you can even go a step further and go into performance. So you look at Angie, she's in very good shape, and she has been using this for performance.
I have, yeah. For my legs, I've been using it for my legs and my calves. They're just a little bit more underdeveloped, and I've been primarily doing it for my right vastus medialis because that one seems to be a little less activated. So I want to try to bring that up and get more muscle activation. So I've been actually using that to help with some of my leg exercises to not only bring up the muscle size to the left side, but just to get that muscle activation.
Awesome. And this is a 4-lead, and the unit does come with a 2-lead and then pads. It also comes with an instruction manual, which goes through a good amount of stuff.
It has a ton of stuff in there. So it goes through recovery stuff, but then it also divides out the book into various different sections. So if you wanted to work on particular areas of the body or a different sport, so like if you're a cyclist or if you're a football player, baseball player, there's a protocol in there for each and every category. So I had been starting off with just using it for the training and the recovery, but this will take you in to if you wanted to, maybe develop your abdominal muscles, or if you wanted to lose some body fat, or if you wanted to use it for enhancing your golf game, your football game. It covers all aspects of sport, and it also just covers aspects of if you wanted to just use it for just recovery, like where to put the leads on it. The diagrams are actually showing you exactly where to put it, right to left, what color lead you're supposed to use. So it really is pretty, I don't wanna say dummy proof, but it's pretty dummy proof.
Yeah, like-
You know, just about anybody can use it, and then, you know, it comes with all the
And here's-
additional pads. So this would be for like, if you wanted to train your abdominal muscles, you use these specialized pads that it comes with, you put it on, and then you set your electrical pulsation up to a particular tolerance. And the nice thing about the unit is, you know, it goes up in 1/10 of an increment. So it doesn't just jump up like 10% at a time in intensity. You can literally just keep hitting the button and you can go like, all right, I'm at 10%, now I'm at 11, 12, 13. And so you can keep progressing up.
Yep.
And every muscle group is going to respond differently, and the intensity is going to feel a little different. So like when I put it on my legs, I can tolerate a pretty high level, but I can tell on my left side, if I have it at 60%, I don't feel it as strongly on the right side because I don't have that same motor neuron stimulation that I have actively. So then I can tell like, all right, so I definitely have some decreased motor neuron sensory on this side. So then maybe I would then just put my pads on one side and just do unilateral training versus doing bilateral training to try to bring that up. So
Right, and she's going through something called neuromuscular retraining, which is, so she has a right knee issue, and I forgot about that, so thanks for bringing that up. So, and she's going through like how she can feel this leg being stimulated really well, and then the right leg she can't feel as much. So then she's gonna do a unilateral style training to try to recuperate the motor neuron firing to that muscle. So she's essentially is through performance, and technically you're rehabilitating and treating the knee too at the same time. So we can do a lot of stuff even with just a portable unit. It's pretty powerful. And then we can go into like the RX100 and how powerful that is. But for now, like she's been getting great results with the portable at home. She's also been treating her own right knee. But as far as the shoulder, she wanted to come to us today to go through a shoulder treatment on the left. And we're gonna run through that, but we're gonna do it with the RX100 because we have that here today. So I'm gonna turn it on for everyone to see. And it's completely touchscreen. This is a $30,000 unit. It's pretty much the cost of our X-ray unit. It's very sophisticated, very powerful. And a lot of people are just gonna say, oh, it's just a really high-end TENS unit. It is definitely not. This is a direct current machine. So TENS units are alternating currents, and they're blocky waves. So when they go into your brain, there's a communication between a TENS unit and your brain, and the waves are very blocky, so the communication isn't good. So it puts the muscles into a contracture state, and then you can't get out of it. With a direct current, they are introducing wavelengths that mimic your brain waves, and then you can actually go through active therapy treatment. And then this goes through our neuromuscular retraining component, which is what Angie covered. And so we got pulses per second, which is the amount of pulses that we can introduce to somebody. And so we treat at 500, and we can bring this literally all the way down to 40. It's gonna take us a while to get down there, so I'm not gonna go all the way down there, but the 40 pulses per second we usually use more so for performance-based stuff, and then for treatment we do 500 pulses per second. The PRS is at a fixed 240 pulses per second, so it's good for both treatment and performance. It's a good intermediary pulses per second. And our brain is capable of doing 2 pulses per second. And so the power of this machine is we can essentially go into multitudes of how many more pulses per second we can force your body to do. We're basically hijacking your mind and making it do what we need it to do so that you can heal and perform better. So with Angie, we're gonna go through performance treatment. So I'm gonna put some timer on the clock here. And the very first thing we're gonna do is we're gonna find something called hot spots. These are areas of dysfunction that when we put the pads on, she'll feel this intensity or maybe even pain. Most people describe it as intensity. So first we're gonna ground her with one of the pads, and then we're gonna go through and start finding those hot spots.